Hi, my name is Donna Mieciecki. I'm a nursing student at the Community College of Philadelphia. Today I'm going to talk about a little bit about the process of blood donation and the benefits for the recipient and for the donors. First, I'm going to give you a little history about how we came about to discover that it was possible to donate blood and transfuse it to another individual. It started back in the 1800s when researchers decided to try and transfuse blood between animals. The first successful blood transfusion took place between two dogs. After that, scientists decided to experiment a little with transfusing sheep blood into a human. They picked a mentally ill patient and transfused a little sheep blood into him, and surprisingly he survived the experiment. It is thought that he did because they only transfused a small amount of blood, or else the events could have been disastrous. After that, they experimented with transfusing other substances such as water, cow's milk, and more sheep's blood, which all turned out negative for the person who was transfused into. In the 1930s, it was discovered that humans carried different blood types, and that was when they discovered the three dominant blood types, A, B, and O. Soon after followed the discovery of the Rh factor, which is called the rhesus factor, that is a surface antigen on red blood cells that determines whether a person is positive or negative. The O-negative donor is the universal donor. There is only 7% of the world that carries this blood type. This goes on to the topic of blood transfusion. We all carry different blood types. As I said previously, the only universal donor is O-negative. Therefore, any blood type can receive that blood, but other blood types can only receive their certain blood type that they carry already. So in this case, I'll walk you through the process of blood transfusion. The blood donation, I'm sorry. The first process is you go in for your mini checkup. They take your blood pressure. If you have hypertension, they normally don't let you donate blood at that time. They encourage you to come back when your blood pressure is a little lower. They take your hemoglobin level, which can't be under 12. In the next case, they ask you some questions specifically about your past, if you were a drug user, your sexual partners, if you traveled out of the country within the past 12 months, if you are a carrier of AIDS, Chagas, or hepatitis. And then if you pass that round of questions, you will move on to blood donation. At that point, they lay you on a stretcher and take approximately 2 pints of blood if you're just doing a regular donation. If you were going to do a double red cell donation, you would be hooked up to an apheresis machine, which separates the red blood cells from the rest of the components of the blood and returns your plasma and platelets and keeps the red blood cells, but also gives you some back in return. People are eligible to donate blood every 56 days. Personally, I try to go at least 4 times a year. The reason that I came onto this topic was because I took care of my grandmother when she was diagnosed with non-small cell lung cancer, and she needed to get chemo for about 6 months. And during that time, she was already underlying anemic, so the chemo made her hemoglobin go even lower. When she was always around 7, as I said before, the normal is 12, they would transfuse her. And I was always so happy that there was blood available for her to be transfused, and I thought to myself, like, what a selfless act for someone to be able to do that for another individual when it's so important for them to need it for life, and it's actually like an easy thing to do for the rest of the population. So ever since that time, I started donating blood myself. There are 8 reasons why donating blood is beneficial for the donor also. The first one is a free mini medical checkup. As I said before, there's a long process that you go through, and you know, if you don't have insurance, it kind of can be good to get your blood pressure taken and check your hemoglobin. The next thing is it decreases your cancer risk. The next is it reduces your risk of heart attack because it makes your blood go through a process of hemodilution, which thins your blood. If it's normally a little thicker, it'll thin your blood and make it less likely for you to have a heart attack. It replenishes your blood, which it means it takes some of your old red blood cells and it makes your body regenerate new ones, which are much more capable of carrying oxygen. If you're a universal donor, which is O negative, the more reason for you to donate blood. I mean, you just know how many people you're helping, because that blood can obviously go to anyone. You can become a hero. Of course, like, as I said, blood can only be used for a person if it's on the shelf, processed, and ready to go. If that blood isn't available, that person will not live. I mean, that's how life-sustaining that it is and how necessary it is. And of course, the need much outweighs, you know, the amount of blood that we have, so we are always in need of replenishing and changing the blood supply. Just as you can only donate every 56 days, the blood is only good for 56 days. So, of course, I'm sure it would get used in that time, but every 56 days they're in need of more blood to put on the shelves to be used. You receive incentives. I know the Red Cross, where I normally donate, gives a donor card, and every time you do, they give you points which you can use for movie tickets, like fast food restaurants, all types of things like that, and it's free. So these are the reasons why you should. Of course, it's a great thing. You know, it makes you feel good, and you don't have to do anything to do it. It's free for the donor, and I just encourage everyone to become a blood donor. Thank you.